morning, and welcome to the third presentation of the department's cross-training series. My name is Susan Nestor, and I'm the director of the Health Insurance Smart NC program here at the Department of Insurance. And I'm looking forward to talking with you this morning about Smart NC services. But before I begin, I'd like to thank Dr. Osborne for creating this cross-training series presentation. I think it's fantastic whenever we can learn about each other's divisions and how we can better help North Carolinians across the state. So, with that being said, let's talk about Smart NC. Smart NC is a statewide consumer assistance program that began April of 2011. The goal of the program is to assist consumers with their health insurance issues, and in particular, we look to help consumers resolve those issues with their health insurance company. Smart NC assists consumers who are covered under private health insurance plans. They can be a group or an individual plan, a plan that's purchased off the federal exchange. It can be the state health plan or other self-funded plans. And the services provided by Smart NC are provided at no cost to the consumer. So let's talk about exactly what Smart NC does to help consumers in North Carolina. We provide 4 lines of service to the consumer: medical appeal assistance, complaint resolution, external review request assistance, and consumer counseling. So I'm going to talk briefly about each one of these services so you understand what we do. So the first is medical appeals, and this is our largest line of business. So when a consumer receives a denial of coverage for a service or payment for a service, or denies the prior approval of a surgery procedure, the consumer is given rights to file a medical appeal. Well, Smart NC can help you with that. Smart NC will work with the consumer to obtain their medical records, to obtain a statement from their physician. We'll reach out to the insurance company to obtain a copy of the insurance company's medical policies and review criteria for approving these kind of procedures. We'll gather scientific evidence information. We will put all of this together and we will create a written persuasive argument. And then we will file this argument, this medical appeal, with the insurance company on behalf of the consumer. And we will do that for 1 or 2 levels of appeal. If a consumer fails to win their first level of appeal, then we will help them do the second level of appeal. But we can help consumers with their denials from their health insurance company. The second is complaint resolution. And examples of complaint resolutions could be where there's an enrollment issue involved, or there could be a pharmacy issue. When we file complaints, we file them again with the insurance company. We'll hear back from the insurance company in 7 days, and then we'll either have a resolution or we'll know what our next steps are going to be once we hear back from the insurance company. Now, Smart NC assists those consumers who have a complaint that are covered under the state health plan or other self-funded plans. If a consumer is covered under an individual or group plan that the department regulates, then those complaints are handled by the department's Consumer Services Division. And if someone were to send that complaint to us, then we do a soft transfer to the Consumer Services Division. But we make sure everyone is connected and gets the service that they need. The third level of service, type of service that Smart NC provides is with assisting with external review requests. Someone recently asked me exactly what is an external review. And what we're talking about is consumers in North Carolina who are covered under fully insured plans or the state health plan have the right to request an independent medical review of their health plan's denial of coverage. So the health plan had to first say, no, this service was not medically necessary, or issue what we call a non-certification decision. And that decision could say not only is it not medically necessary, but it may state that it's an experimental issue and or it could be a cosmetic issue. So once they receive that denial, they would contact the department to go ahead and fill out a request for assistance form for external review. From there, they would then send that to us. We'll review it. We'll reach out to the insurance company to gather some additional information. We, the Department of Insurance Smart NC, makes the final decision on the request information. If we deem it to be eligible according to North Carolina state law, then we will assign that request to one of our 4 contracted vendors who perform independent medical reviews. We screen those vendors for any conflict of interest to make sure there's no one that would have any relationship with the consumer's denial. The case is assigned to that independent review organization. The organization will then select a clinical expert who actively practices in that area, make sure there's no conflict of interest with that physician provider. And that reviewer will then review all of the information from the insurance company, from the patient's doctor, from the patient themselves, all of the information that's been submitted, and they will consider that information, and then they will also review all of the scientific information, evidence-based information out there regarding that denial, and that individual then will issue a decision to either uphold the insurance company's denial or overturn the insurance company's denial. And if they overturn the denial, then the insurance company has to pay for the procedure, the claim, they have to approve the prior denial of the surgery. Whatever the denial was, it's overturned, and now the insurance company has to pay. There are 2 types of external reviews to be requested, standard and expedited. And so that you know, a standard external review will be resolved within 45 days of our receipt of the request. For an expedited external review, it's 3 calendar days, so it goes very quickly. But that's how the external review process works. The last service that Smart NC provides to consumers is consumer counseling. We are available to talk with consumers about prior approval situations, about their explanation of benefits that they receive from the insurance company. I've had so many people talk to me and say, I received a notice from my insurance company that said that I owed $2,000 and I paid it, but I always wondered whether it was really correct. Well, we can help you with that. Call us. There's no charge to call us. We'll review your explanation of benefit with you, look at what your coverage includes, look at the benefit booklet, and then we can together talk and determine whether indeed the claim was adjudicated correctly. So Smart NC is here to help you with that. So the next slide that I'm going to share with you is from a consumer who worked with the Smart NC program. Her name is Miss Lisa Shank, and she was part of an interview done by the News and Observer about Smart NC in October of 2017. And Ms. Shank shared with us that we could share this video with you, and it'll give you a sense of how Smart NC helps consumers, and then following that, I'll give you a few more examples. So I hope you enjoy.
It took me 4.5 years to get diagnosed with an extremely rare neuromuscular disorder. There are 3 types of treatments to treat stiff person syndrome. They are all very expensive and difficult, and because their disease is so rare, everything is considered experimental in insurance eyes. So they denied my claim to get the treatment to slow the progression, and once that happened, we tried to appeal ourselves, and it got denied again. Smart North Carolina is a program that is for the consumer, and it's provided by the state of North Carolina, and it protects the consumer's rights with the insurance companies, and they work on the behalf of the patient. Our representative at Smart North Carolina was Connie, and she made it as easy as possible on us. She's extremely precise, and my husband was kind of on his own and had a difficult time trying to provide all the care for me, and so it was really nice to have an ally. The transplant worked for me. They took me off all medication and essentially saved the insurance company all of the IVIG treatments and all of the doctor visits, so they probably made up their money for paying for the transplant. They made up their money immediately with me in the first year. Once I realized I had such a rare disease and the treatment options were so incredibly expensive, I offered my husband a financial divorce or a divorce because I knew I was going to ruin us. And going to Smart, North Carolina, they saved us so much money. We probably would have lost everything we had. And I definitely feel like I would have lost my life as well. And we just owe them more gracious ingratitude than we could ever offer back to them.
All right, so I hope that you found Ms. Shank's explanation of her working with the Smart NC program helpful and gives you some insight into what we do with consumers who have health insurance issues. Now I want to share with you a couple more examples so you have a good understanding of how Smart NC can assist consumers. The first is an example that we had a few months ago with someone who came to talk to us. Their family member was scheduled to have some back surgery, and they thought they had the insurance company's approval. And 24 hours before they were to go into the hospital for the back surgery, they received a call from their insurance company telling them that their back surgery was not approved. So we received a visit from the consumer who said, is there anything that you can do to help us with trying to get this approval in place so that the family member can go ahead and have the back surgery? And we went to work on that, and we gave them, we counseled them, gave them guidance to say, all right, are there any tests that perhaps the health plan has not yet received that would be new, recent, that would be helpful? And they said, well, I think there is a recent MRI. And I said, then we want to get that sent to the insurance company. The second is, can we have your physician do an updated statement to get sent to the insurance company, and have your physician go ahead and call the physician at the insurance company to do a peer-to-peer conversation. So the consumers went to work on that. All of that information was delivered that afternoon. They shared with me afterwards that they had till 9:30 the next morning to make a decision whether they were going forward with their surgery or going to cancel it, because they had to know one way or the other in terms of what the insurance company was going to do. And at 9:20 that morning, they received a call from the insurance company which let them know that after further review and receiving additional information, they had approved the back surgery. And the family went in, the back surgery was done on the consumer, it all went well, and that's just a good example of when there is a denial for a surgery to take place, how Smart NC can help, even at the last minute. The second is a medication denial. We had a consumer who is diabetic, who had been on a medication for his diabetes that he had done very, very well for 20 years, just extremely well controlled. But the employer changed health plans. And when the consumer went to have the prescription filled under the new health plan, the health plan denied it. They said, no, you need to go on this particular medication. And the consumer did not want to do that, so they started paying out of pocket. And in the meantime, the consumer contacted Smart NC, and we worked with that consumer on a medical appeal. And the medical appeal was filed on behalf of the consumer with the insurance company. After a thorough review by the insurance company reversed their decision and approved the consumer to receive that medication that he had been on for 20 years for 2 years with no further prior necessary action. So again, and that saved that consumer who had started paying out of pocket for that 2-year period at $19,000. So that's another example of how Smart NC assists consumers. The last is that we work with someone who had back surgery scheduled. They went through the back surgery. They had prior approval by their health plan. Everything went smoothly. And then after the surgery, the bills started coming in. And again, everything was approved. They didn't expect any surprises. And when the anesthesiology bill came in for this outpatient surgery, the insurance company denied payment. And that seemed strange. Why would the insurance company deny payment when they approved the surgery? Something just wasn't right. Again, this person shared with us, well, I can pay the bill, which was $2,200, but I'm just wondering if I should. And so SmartNC went to work to set up a three-way call between the insurance company, between the anesthesiology provider's office, and SmartNC, and we went through the explanation of benefits notice from the insurance company to come to find out that the anesthesiology company had submitted their invoice based on an inpatient procedure. But in fact, the consumer had their surgery outpatient. And because it was an outpatient procedure, not an inpatient procedure, the insurance company denied payment. And so the anesthesiology company was going to go ahead then and try and collect from the consumer. Once we had the three-way conference call and talked through the issue, the anesthesiology provider adjusted their invoice, their claim, their CPT code, resubmitted it to the insurance company. The insurer paid the bill, and the consumer had no out-of-pocket expense. So those are some examples of how SmartNC can help consumers with resolving coverage disputes with their health insurance company, and again, at no cost. Okay. So some program facts about SmartNC. SmartNC staff is a clinically focused staff. Some are clinical staff by training. Others are clinically through online classes and worksite experiences and places they have worked. They're familiar with medical records and all of the different things that need to go on for them to be able to assist consumers. We have received over 13,500 consumer requests for assistance since the program started in April of 2011. We've had over 81,000 consumer calls for assistance, over $19 million in recovered benefits by assisting consumers. And I will tell you that when we talk about recovered dollars, we have assisted consumers where the dollar amount has been $60, and we've had recovered benefits over $600,000. And over 55% of cases are overturned in favor of the consumer. So how can consumers learn about SmartNC? Well, the first is that whenever you receive a denial of coverage from your health insurance company, you will find information about SmartNC in that denial. Last week I spoke with someone who knew about the SmartNC program. They were familiar with it. They knew what we do. They knew that the insurer had to provide the information. And when I spoke with this individual, she said, but the information is on page 6, page 7. And she's correct, it is. She said, couldn't we move it up? Well, in fact, the insurers also have to be able to explain why they denied it and provide their criteria and some additional information. But if you'll make it to page 5, 6, or 7, indeed, all of our information's there. You're being advised to contact SmartNC for assistance, our phone number, our website. It is all there. The second way to learn about SmartNC is through the department's website. We have a lot of information up there about SmartNC services, including an online medical toolkit for consumers who want to go through the appeal process but might not want to have a third party involved. And the medical toolkit includes directions, instructions on everything you need to know about filing a medical appeal, and it also includes letter templates to be used if you're going to file the letter with the insurer or request information. So we've tried to make it as easy as possible for the consumer. The third is word of mouth from consumers who provide and have used SmartNC services. We have a lot of consumers who have used us before and then will call back and actually ask for an analyst by name. And because they had such a good experience and they think the program is amazing. In fact, they think that we are North Carolina's best kept secret, which is what we don't want to be. We want everybody to know about SmartNC services. We have a lot of referrals from provider practices, hospital care management teams, business offices, hospital billing departments. We've met with them, with the North Carolina Hospital Association, North Carolina Medical Society, to try and get the word out to all of their members as well, to let them know that if they have a consumer who is having difficulty with getting a bill paid by their insurance company, to contact Smart NC, that we can help them with that. And lastly, we get help in spreading the word from people like you. And so I just want to take this opportunity to say thank you. So how can you help? How can you? What's your part in this? Well, I promise someday you, a member of your family, someone you love, a sorority sister, a minister, the guys you go to football games with or out to dinner with. Someday someone will share with you that they just received a denial from their health insurance company and they have to pay a large bill and or have to file an appeal to try and resolve the issue. And frankly, it's overwhelming. It's upsetting, it's scary. Whenever you talk about health and you talk about money, it's a very scary situation. And so what can you do? Refer them to Smart NC. We're here to help them. That's what we do, and we do it very well. So help us to help you and to help your friends and family. Smart NC helps consumers resolve coverage disputes with their health insurance company, and we do it at no cost to the consumer. So it has been a pleasure being here with everyone today. If you have questions, I'm happy to go ahead and answer your questions, meet with those questions after this presentation. You can also go ahead, and Smart NC is located on the second floor of the Albemarle building, right across the hall from room 245. So you can come and see us and visit us, and I promise you everything we say and do is confidential. You can also call or email me. My email is susan.nestor, Nestor, @ncdoi.gov. And again, I'd like to thank all of you for being here today. It has been a pleasure to be able to talk with you about the Smart NC program, and let us know how we can help you, because that's what we're here for. We are the Consumer Assistance Program. Thank you. Have a great day.